as I mentioned, axial skeleton, where it involves the skull, mandible, the sternum, rib, the rib cage and the vertebral column. So 1, 2, 3, 4. So it all constitutes skull, vertebral body, sternum and rib cage. It constitutes around 80 bones. The girdles, the appendicular skeleton, which includes the shoulder joint, hip joint, we call it as a pectoral girdle. We call this part as a pelvic girdle and the bones attached to it. It is around 126 bones we have. So what we expect from yoga teachers is to have a basic understanding of the naming of the skeletal system and what it grossly functions. So function is, say for example, lungs and heart are situated deep within. So it will protect, the rib cage will protect the vital organs. And all the long bones have red bone marrow and yellow bone marrow. Red bone marrow is the one which will produce the red blood cells. So hemopoiesis we call. So the yellow fat we call yellow bone marrow. It is a production house for various chemicals, and it's a storehouse for the energy system, energy in the form of fat. And when we see, the skeletal system also constitutes the storage of various minerals, mainly calcium and other mineral storage. So grossly you can understand as a protection, storage, the vitamin production, the storage, protection and movement. Because of the presence of joint, it will also help you for the movement. As a yoga teacher, I want you to grossly name the skeletal system. You can just say with me: skull, mandible, clavicle, humerus, ulna and radius, carpal, metacarpal and phalanges, the hip bone, vertebral body, sternum. Here we divide it into manubrium, sternum, xiphi, rib cage. There are 12 pairs of ribs, and there is one more extra bone called as hyoid, femur, patella, tibia, fibula, tarsal and metatarsal bones. So all these things, if you are able to name the skeletal muscles or the names when you are doing an Ardhakati Chakrasana, when you are raising your hands up, what are the joints which are working there, what are the bones which are working there, if you are able to understand it, is enough. So there is a movement of the humerus at the level of pectoral girdle in the format of what you just now you studied is abduction. So there is abduction happening, then you raise your hands up totally and do the Ardhakati Chakrasana. So hands will go towards that side. So what are all the different movements are happening at the level of joints? If you are able to see the presence with this POP skeleton, it is not an original skeleton. It is done for the sake of studying. Original skeleton, when you see your own body, when you see from the surface, I feel the clavicle, collarbone. So that is called as surface anatomy. When you are able to appreciate the muscles and bones and tendons from the outside, you are able to recognize those bones, then you are well versed with your yoga postures. Then you are able to do much better in terms of you as a yoga teacher, you can do much better and you have an edge over all other yoga teachers.